My name is Luke Bruner, and this is a presentation on neck anatomy. First, the muscles of the neck. It's important to understand that a lot of the names of the neck muscles are made up of different parts that point to where their insertion and origin points are. So for instance, the first muscle we see here, the sternocleidomastoid, has insertion points on the medial third of the clavicle and on the sternum. And it also has an insertion point on the mastoid process of the temporal bone. This makes up the parts of the name the sternocleido for the sternum and clavicle, and mastoid for the second insertion point. You can also see the sternocleidomastoid cut here on the cadaver image. Cut right there. The next muscle, the sternohyoid, has attachment points on the hyoid bone and on the sternum. You can again see the sternohyoid on the cadaver image here, running from the hyoid to the sternum. Here you can see the sternothyroid deep to the sternocleidomastoid muscle. You can also see it deep here on the cadaver, the sternothyroid muscle. The sternothyroid has attachment points on the thyroid cartilage and on the sternum. The inferior portion of the omohyoid muscle can be seen here, and the superior portion of the omohyoid muscle can be seen here. You can notice that it takes an odd angle as it comes down the neck. The omohyoid muscle acts to depress the larynx and the hyoid bone during swallowing and speech. The mylohyoid can be seen here running from the mandible to the hyoid bone. It forms a sort of floor on the oral cavity of the mouth. The last muscle I'm going to point out on this slide is the stylohyoid muscle. You can see it running from the styloid process of the temporal bone to the hyoid bone, and it'll act to pull the hyoid bone upward and backward during swallowing. A group of muscles located more laterally on the neck are the scalene muscles. The scalene muscles are a group made of the posterior scalene muscle, the middle scalene muscle, and the anterior scalene muscle. These muscles are going to act to flex the neck laterally. They will also act to elevate the rib to which they are attached. The last muscle I'm going to point out is the digastric muscle. Judging by the prefix di in the name, there's going to be two parts to this muscle. The anterior digastric muscle will attach to a medial portion of the mandible, and it will attach to the posterior digastric muscle by the tendon indicated here. The posterior digastric muscle will then angle back and attach to the mastoid process. The anterior and posterior digastric muscles will act together to raise the hyoid bone during swallowing. The next structure we will cover in the neck is the larynx. The larynx is a cartilaginous structure in the neck through which air travels. It also contains the vocal folds. This is why it can be known as the voice box. The larynx is located inferior to the pharynx and will act to connect it to the trachea. In the diagram, you can see the thyroid cartilage, which is usually larger in males due to the more testosterone. Inferior to the thyroid cartilage, you can see the cricoid cartilage from the anterior and the cricoid cartilage from the posterior. From the posterior view, superior to the cricoid cartilage, you can see the arytenoid cartilage, and superior to that, you can see the epiglottis. The top portion of the epiglottis can also be seen from the anterior view. Next, the muscles of the larynx. Again, the names of the muscles can tell you a lot about their insertion and origin points by indicating which cartilages they connect. First, the cricothyroid muscle has attachment points superiorly on the thyroid cartilage and inferiorly on the cricoid cartilage. Seen from the posterior view, the posterior cricoid has attachment points in the cricoid cartilage and the arytenoid cartilage. And the lateral cricoarytenoid, seen from this lateral cut, also has attachment points on the cricoid cartilage and the arytenoid cartilage. The transverse arytenoid muscles can be seen here crossing each other. They have attachment points on the arytenoid cartilage. Lastly, the vocal folds can be seen from this lateral cut. They can most easily be seen from a superior view looking down into the larynx. Next, the thyroid gland. The thyroid gland is located inferiorly to the thyroid cartilage. It can be seen here colored green in this cadaver image. The thyroid gland acts to release hormones that help regulate a lot of the body's metabolic functions. A clinical application dealing with the thyroid gland is Graves' disease and hyperthyroidism. Graves' disease is an autoimmune disorder that causes hyperthyroidism. This results in an overproduction of thyroid hormones. Graves' disease is the most common cause of hyperthyroidism and can affect 1 in 200 people. Women are also 7 to 8 times more likely to suffer from Graves' disease than men. Some common symptoms of Graves' disease can include fast and irregular heartbeat, tiredness and muscle weakness, trembling hands, and weight loss. Problems with the thyroid gland can be dealt with chemically or by surgically removing the thyroid gland or parts of the thyroid gland, the nerves of the neck. First, the vagus nerve, also known as the cranial nerve 10, innervates cardiovascular, digestive, and other important organs and organ systems. The vagus nerve can be seen running from the cranial region down into the chest cavity. It will continue running inferiorly, while a branch known as the left recurrent laryngeal nerve will loop underneath the arch of the aorta. The phrenic nerve is important in respiration as it provides motor innervation to the diaphragm. It can be seen more lateral to the vagus nerve, still running vertically through the neck area. Lastly, the brachial plexus, originating in the neck, will move laterally towards the shoulder and arm to innervate the shoulder, arm, and hand. The trunks of the brachial plexus can be seen here in the image. Finally, the blood vessels of the neck. These include the common carotid artery and the internal jugular vein. The internal jugular vein will drain the blood from the face, neck, and brain. As the common carotid artery moves through the skull, it will split into the internal carotid artery and the external carotid artery. As a rule of thumb that I work by, the external carotid artery supplies blood to the external structures of the face, mostly those outside of the skull. Conversely, the internal carotid artery supplies blood to all the structures inside the skull. The last structure I want to point out is the carotid sinus, which is a little bulge at the base of the internal carotid artery. A strong pulse can be found by feeling the carotid sinus. When you see people in a movie or a show checking a pulse of someone by feeling their neck, this is what they're feeling for. Now to end here, we're going to go through a couple quick review questions. The first question is, what muscle makes up the floor of the oral cavity? Is it A, the stylohyoid muscle, B, the mylohyoid muscle, C, the digastric muscle, or D, the sternothyroid muscle? I'll give you a few seconds to think about it. The answer is B, the mylohyoid muscle. Next question, which two structures does the cricothyroid muscle attach to? Is it A, the arytenoid cartilage in the epiglottis, B, the cricoid cartilage and the arytenoid cartilage, C, the thyroid cartilage and the arytenoid cartilage, or D, the cricoid cartilage and the thyroid cartilage? Give you a couple of seconds again. The answer is D, the cricoid cartilage and the thyroid cartilage. Third question, which nerve or nerve bundle in the neck innervates the diaphragm? Is it A, the phrenic nerve, B, the brachial plexus, C, the vagus nerve, or D, the facial nerve? The answer is A, the phrenic nerve. Fourth question, a true or false. The sternothyroid muscle is deep to the sternocleidomastoid muscle. True or false? And the answer is A, true. And last one, number 5, another true or false. The larynx is located superior to the pharynx. True or false? And the answer is false. The larynx is inferior to the pharynx. Remember that it connects the pharynx to the trachea. So from superior to inferior is pharynx, larynx, trachea. I hope this presentation helped out and you learned something. My name is Luke Bruner. This has been Neck Anatomy. Thank you very much and have a good day.